She is my patient, Dr. Bhargavi, who had both hip replacements done by the MAKO Robot within the span of 1 week. And it is now 3 months since she got operated, and she walks beautifully. And we will hear the story of her experience from her own words. Bhargavi.
Sure, sir. First, I want to thank Dr. Gurava Reddy and Dr. Adarsh for treating me, and it's a huge success. So initially, I was at my workplace, and it started with some mild hip pain. I was just not able to walk at all. And then a couple of tests were done, and I was diagnosed with bilateral AVN in my hips. And I had a lot of pain, a lot of trouble. I couldn't walk, I couldn't sit. And I met Dr. Gurava Reddy, and all my questions were answered. And sir suggested me about the robotic replacement, which is the latest technology. And the healing time is less, and there are a lot of advantages with that. So we took suggestions from our friends and family. And most of them suggested that it's a good option to go through. And then we decided, and we got both my hip replacements done at Sunshine within a week, Monday and Thursday. And I was discharged home, and there's a physiotherapy team who assists us post-surgery. And for 1 month, I took physiotherapy, and I am able to walk pain-free, and I'm able to do things on my own.
A normal young lady who can act in a movie. Thanks, Bhargavi. I've been operating knee replacement surgeries for the last 25 years. I must have done more than 50,000 joint replacements manually using my training and my hands. But for the last 2 years, I'm doing the robotic assisted joint replacement surgery. The main difference I found is the immediate pain relief for the patients in the first 2-3 days, which is remarkable compared to the manual knee replacement surgery. What I mean to say is the immediate post-op day, usually very painful, but in the robotic assisted knee arthroplasty, first day and second day, the people do not feel the pain at all. They are so comfortable. One main reason I attribute this to the less cutting of the soft tissue and accuracy of the bone cuts. I have waited for 5 years, and I saw almost 10 robos, and then I decided to zero down on MAKO because of the 3 following reasons. Number 1, MAKO has been in the game for the longest period of time with more than 1,000 research papers published. There is no other robo in the market now which has got such a peer-reviewed literature available. Number 2, MAKO is the only robo which has got application for 3 joint replacements. 1, totally replacement, 2, partially replacement, and 3, total hip replacement. Point number 3, it is the only robo which has got a haptic control. In other words, the robo arm does not allow me to cut outside that haptic boundaries. That means preoperatively, after seeing the patient's anatomy, the robo and me decide that we are going to operate in between these 2 lines. And if I, by mistake, go out of that, my drill does not work. The robo will not allow me to cut outside the haptic boundaries.